Good morning, good morning. What's on my mind? I'm Dr. Dangleben. On behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is your daily medical tidbit. I want to go into some of these things that we see in the Caribbean, especially when we were growing up, that we didn't quite understand. And I want to talk about elephantiasis. And for my Dominica peeps, we call it guopie, and we tend to associate it with evil and curses and things like that, but it's not. Okay, it's something called it's elephantiasis, but it's also what's called lymphatic filariasis. Okay, it's a mouthful, but it's chronic swelling develops, but it's from a mosquito-borne parasitic disease. Okay, and it's actually caused by a worm, a nematode worm. All right, and I'm not going to get into the medical term of the worm, but in the Caribbean, especially in places like Haiti, and I'm not trying to stigmatize it is what it is, and we saw it growing up in Dominica that it's been a major cause of disability and stigma. The stigma piece is important, right? The legs get very large, and usually it can be bilateral, or it's unilateral, or even scrotum, right? You can have it in your scrotum, but the key here is this. This is spread by mosquitoes, right? That is mosquito, and what happens is the mosquito ingests the larval form of this worm when it bites a human, right? And then this larva develops into an infective form inside the mosquito, all right? And then it transmits it to another human that it bites. And that's how it gets into the body. And then these larvae, these little worms, migrate into your lymph system, your lymphatic system, and develop into an adult worms. And the thing about it, 10 years. Up to 10 years, it lodges itself in your lymphatic system, especially in the legs, like I said, your scrotum and your groin. And if you block your lymphatics, it obstructs the flow of lymph, thus causing lymphedema, the swelling, okay? And that progresses to elephantiasis, what we call guopie in Dominica, right? And then you have repeated infection, inflammation, scarring, and this is irreversible. We've seen it, right? I was taken to somebody's home after Maria when I went down, and said that this person has been struggling with this for many, many years. And I went to see it, and that's what it was. It was elephantiasis, right? So it's secondary to a mosquito transferring the larva that forms into a worm into your system, right? Initially, for maybe a year, it can be asymptomatic, right? But once it starts going, you get tender nose, you can get fever, you can get chills, right? And obviously, chronically, you get the swelling, all right? Even the men that used to get the very, very, very large scrotum, and you would think it was a scrotal hernia, but it was elephantiasis of the scrotum, okay? And it's psychosocially, it destroys the person. The stigma, this disability, this disfigurement, right? And I can tell you, as young people, we were not sympathetic because we didn't understand, And then you would hear older people saying, well, it's a curse, it's this, it's that. But there's been a lot of global programs, focused on elephantiasis, and you've seen a reduction in that compared to maybe 40, 50 years ago, all right? But a lot of people in the region still has it, okay? The key is early detection, but even then, once the damage is done, the damage is done, all right? So the chronic lymphedema cannot be reversed. You want to start anti-parasitic therapy, okay? You want to start things like albendazole, all right? And there's a whole variety of combinations that you can use, even the controversial ivermectin. And the goal is to kill the microfilariae, which is the little nematodes before they get into full adult to establish elephantiasis. Hygiene is important, mosquito control, skin care, elevation, exercise, compression therapy, all these things are available. But I think the key for public health is vector control, right? Mosquito control, because mosquitoes, and it's not just elephantiasis, it's not just Guopier, right? Dengue fever, there's so many things, right? Right? I'll get into some of these and subsequent lectures, but education is key, right? This is not a curse. This is not some evil voodoo or obia. It comes from a mosquito, all right? So let's be conscious of this thing. Let's educate ourselves, right? Let's not dig into the stigmatization, and be sympathetic, be empathetic, right? Be loving, be caring. And docs, please take the time, because we see these things not as much as before, but educate your patient. Try to put them at ease, right? Governments have to work on the eradication of mosquitoes and things, and do it in such a way that you don't further endanger your population. All right, and there's a lot to read up on in that topic. It's a very, very broad, deep topic that you could find time to read up on. I just wanted to put that out there to discuss, lymphatic filariasis, and which is elephantiasis, so you have a better understanding. All right, I gotta go. Have a great day. Peace.